Good morning. My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I am welcoming here again our good friend Linda Harvey to the Patient Prism webinar. And we're going to talk a little bit more about the impacts of COVID on dental practice. As we know, over the last month and a half, dental practices have begun reopening with newer protocols in place. And Linda, obviously, as you guys know, we've had her on the program several times. She's been a contributor to our academy for many, many videos. And she is the compliance and risk management expert in the dental field. She's the founder of the Linda Harvey Group, as well as the Institute of Dental Compliance and Risk Management. She teaches dentists and team members all across the country on how to protect themselves as well as the patients. She is a widely known speaker nationally at conferences. And obviously what she does is in the spotlight since COVID has hit. And she's been very busy. So I appreciate you, Linda, coming on the show and really sharing your wisdom, because a lot of our clients need this help.
Well, thank you, Amol. It's my pleasure to be back again and share updates. As we know, every time we get together, there's so many new things to talk about, and I feel like we're in so many new rabbit holes. So we'll help provide some practical suggestions and updates this morning.
So, no, I appreciate that a lot. And my question right off the bat to you is, how has in dental practice is always focused on safety, because that's something that, I didn't understand why dental practices closed down in the first place, because dental practices do more safety than pretty much any other profession. But how has the conversation changed with respect to safety in a dental office?
Well, yeah, that's very interesting, because when you think about the past 4 months, the conversation has changed dramatically from none of us knew what SARS-CoV-2 was and the different PPE and learning even what a respirator mask was. But I can remember back in February and March that many dentists didn't even know the different levels of masks. So now the conversation recently has turned to more crisis counseling, because with the increase in cases here in Florida, where we are, in other states, we're finding that COVID is coming to your practice and COVID is in your practice. And what does that mean? So now we're looking at those complex situations where we're kind of coaching clients through that, and team members that reach out to us who are scared or not sure what to do. So that's the conversation is moving that direction now, because nobody wants to get shut down again because of COVID.
Right. I mean, we've got to figure out a way, right? I mean, the point of healthcare is to see sick patients, right? We're going to have patients come in that have the disease. We just have to figure out how to deal with it. I mean, otherwise, hospitals should shut down because COVID patients are coming in. That doesn't happen. What I'm hearing all across the country, and there was we heard about a practice in South Carolina recently where the office was shut down because 4 of their team members tested positive. And this is not just a single story. This is happening all over the country.
Right.
What should people take away from this story? I mean, what can we learn from this?
Well, here's my takeaway from that story. And I liken a COVID exposure like a bloodborne pathogen exposure. Let's analyze how serious it was, what the mechanism was, how much saliva, blood was on the needle, whatever the instrument was involved in that situation. So let's also analyze what was the exposure like to the patient who was COVID positive, and move from there, and then make a good decision tree so that we're not acting in panic or distress. From what I read, it seemed like that office was a small practice, which is typical of many of our private practices across the country. And 4 of the team members got sick, so there probably was not really any team members to see patients. You take 4 team members, though, in a very large practice with, say, 30 or 40 employees, it may not be enough to warrant shutting down the practice. I know one particular large practice here in Florida, very high-end private practice, that had 2 different team members who happened to be distantly related become COVID positive. And because they weren't around other folks in the office, as far as, not being a provider, they were more in the office management area, that they didn't shut down, but they took some other measures, and we walked through that so that staff could feel comfortable with how to manage that. So I think it varies. This is just my humble opinion, but we also would defer to the state health department for any directions and advice as well.
What do you do though when a team member tests positive? I mean, what's the standards right now? Are there any standards?
Yes, there are. The ones that I'm looking at the most are the CDC standards. Those guidelines talk to us about the different type of exposure. How is it a prolonged exposure, or was it an exposure with aerosols? So when you talk about the clinical team being exposed, for example, if the doctors, doctors are always doing aerosols. That's the only way we're generating, income right now. And the hygiene teams vary from practice to practice. Some hygienists are still reluctant to use the ultrasonic. Some have gone back because they've implemented other engineering controls and they're using ultrasonic. So any aerosol generating procedure automatically right off the bat counts as a prolonged exposure. CDC defines a prolonged exposure as 15 minutes or longer without the proper PPE. Now the PPE is a little confusing part though, isn't it? Because should we wear that face mask, level 3, or should we be wearing our respirator mask? And I'm of the mindset now, since the supply chain is just trickling enough when it comes to KN95s and N95s, that I would much rather see my teams with my doctors in that respirator mask than a level 3 where possible. Because if we can go with the higher level protection, then I think you can feel more confident, even if that patient tested positive, that you didn't have an exposure, because you had on your respirator mask, you had on your face shield, you always have on your gloves, you have on your jacket, and you're protected from that patient.
It's not though. I mean, so then if you had all that stuff on, then you don't have prolonged exposure, correct?
Well, I think the exposure may not have been there. This is just me talking as, just a risk manager here. It's considered a prolonged exposure, but I don't necessarily think that you need to banish that person to be home. I think that they would continue monitoring their symptoms and their temperature, maybe bump it up to taking temperatures 3 times a day, and just, monitor them for 14 days. But it also depends now, when you've had that exposure in the practice, where all did that patient go in the practice? How long did they spend at the front desk? So for example, if minimal check-in, minimal check-out, then there's no prolonged exposure there. So if that person was just in one, operatory, hygiene operatory, maybe a doctor check, then it's very limited. And if everybody had the proper PPE, it's probably not much difference. Now I could be wrong, but I will throw the question out rhetorically, is it much different than if the patient had come in with a common cold and flu and you wore the PPE, that maybe you didn't catch it? So I think we don't know that. And I would rather not panic, but then call the health department, get some sage advice, and follow from there. But the CDC talks about the length of time for the prolonged exposures.
But if a team member tests positive, we're definitely letting them stay home for 14 days and do the quarantine, and then have all other team members check to see if they have.
Yes.
Is there a way that you check them every few days? Because you may not have the viral load the same day. You may have it a few days later.
Mm-hmm. So yes, the team member can stay home and self-quarantine for 14 days, and then the doctor would need to consult with their HR specialist to determine if that's going to be a paid time off, because there are some requirements under FMLA and other laws that it may fall into that, and there may not, or there may be exemptions for healthcare. So I would say talk to an expert on HR for that piece, because that becomes a concern for the employee then, who's just getting back to work and wanting their paycheck as well, that now you're sending them home for 2 weeks. So checking that, but everybody else in the practice would just monitor their symptoms. So ironically, I just took a webinar on contact tracing. Okay. And he's a medical professional that presented this, and he's a CEO of an anesthesia group. So what I share with you at first will be more from a medical practice perspective, and then we have to adapt it to our dental settings. First and foremost, he recommended that any public-facing employee be allowed to work from home. So we've done that when we did that during our closures, right? We could check in from home, check out, make appointment calls, and so forth. But more for the most part now, everybody's back at work. I only know of a few people that are allowing some of their team members to work from home because of their healthcare situation, of maybe their spouse or someone else in their household, and they don't want them to come in and have any contact. So it's insurance verification, those types of roles, for example. Kind of hard to put your treatment coordinator at home, for example, But that being said, any public-facing employees, he said, should be working from home. Second, he recommended that you hire a full-time contact tracing person in the practice. Now, that's a little challenging in dentistry, right? Because we may not have the resources and the funds to hire another person just for this role. Right. But if your office is too busy to do any contact tracing, then you may have some issues with getting this job done properly. And by that, I mean, Amol, is that how are we keeping in touch with those patients? Are we able to use our automated systems to do so? For example, I know Weave and Revenue Wells, they all have opportunities where you can set your recall at 3 days, maybe at 5, at 2 days, whatever your follow-up contact time is, and then reach out to that patient several times and let them know you have a contact tracing program in place to optimize everybody's health and safety.
It scares me a little bit to hear this because, at Patient Prism, what we're seeing today is, dentists are having a hard time answering the phone calls in the first place.
Yeah.
So they're so short-staffed that we're seeing really good leads and new patient calls coming into dental offices not being closed because the front office person was busy helping clean the operatory or doing something else.
Yes.
And they're so short-staffed that we're seeing tens of thousands of dollars of revenue go out the window every day. And something that we've been helping our clients with a lot is figuring this out. But capacity is such a big issue, and now having a contact tracing person on top of this is going to be very difficult. I mean, they're overstretched to capacity. They're doing the same amount of production, or 90% of it, with 2/3 of the staff. So I'm going to be very I don't think dental office is going to be ready to do contact tracing, in my view.
Yeah, but I think there's some things that we can do that leverage what we're doing and magnify that to some degree. And that is, you were already sending out text reminders for appointments, right? So I know with Weave, you can send out, because I've experienced this, you can send out your screening questions and you can complete it on your phone or wherever you are. And if that doesn't work, then you could also complete it when you come in person. So let's continue with that. But let's also program, your patient communication platform to reach out to the patient, 2 or 3 days later, and then a few days after that. So you keep yourself top of mind with that patient. So if they become COVID positive, they remember to get back with you. And I'm sure they would, because the health department should be doing contact tracing. But the sooner you know, then the sooner you can begin to make your plan for your practice to find out, okay, what was the exposure level for anybody involved? What do I need to do sooner, be more proactive than reactive.
Before I ask you an interesting question at the end, I really want to, if there's a lot of questions, and not a lot of dental offices have HR departments that they can't just call anybody regarding this, because you can't really afford that. Are you able to provide guidance to dental offices during this time, especially as it relates to these matters? Because otherwise, I don't know who to contact. I don't have an HR department.
Yeah. So we've been advising to certain levels, but when it gets into the HR laws, then I refer them to first I find out, are they working with one of the known companies that we know in dentistry that's an HR expert, like Ben Derrickson Associates or some of the others, because then they can give them more specific advice. If not, and I feel like they need legal advice, because as a risk manager, I have to be very careful. All of us do, not to, I don't practice dentistry, I don't want to practice law, to talk to an HR specialist when it gets really complex. And many times they may have a patient who's in that field, or they know somebody in their circle of friends that they can talk to and get some advice, because we want to do things properly before we end up with any issues with EEOC or, any discrimination cases or just anything. Want to be very careful. We don't have an HR department. You're absolutely right.
For the longest time, we've always known patients have always feared going to the dentist. That's why we only see 50% of America going to the dentist. Now, part of welcoming the patient in the office was, they saw our smile. They were put at ease. And now we've got dental team members in spacesuits, right? It seems like it, with gowns and masks and N95, and the personal touch that you had, where you made somebody feel at ease and they can't see your smile. It's difficult, right? So how do we still, what can we do to still put our patients at ease? And it's not a compliance question, but when you talk to all these people all the time about this, there's got to be a human element to it, where we can say that this is still, we're still in the business of providing care to our patients, and they have to feel, safe and comfortable with us.
Exactly, because I know of a practice up here at one of the beaches here in Jacksonville, where a patient walked in and didn't feel safe, and she turned around and walked out, and the doctors were like, what happened here? So it made them look at, how can we do things differently? And I think our patients are wanting to feel safe by seeing and feeling what we're doing differently. So if they walk into your reception area and they're allowed to sit down and none of the chairs are removed, and there's just, letting a lot of people in, then they don't see anything different there. And they don't see your front staff wearing any mask, or they don't see any sneeze guards. They don't see anything different there. So right off the bat, they're not sure what you're doing, because they've always seen you throughout their dental visits with gloves, mask, and glasses, but they don't know the difference between a respirator mask and a level 3 mask. There's some practices, though, actually, Amol, that I know that are wearing these PAPRs, these pressurized air devices that kind of fit over your head, and they're even a higher level than a N95. And so obviously you can see that difference. And the face shields perhaps would be something different, but so just making sure that you have that warm connection. Maybe it's doing more on Facebook with some live events, just a little, 3 to 5 minutes here and there about something fun or something that you're doing in the office, or sending out a video message through your platform, your communication platform. Maybe even something cute like a little badge that can be laminated and disinfected, with a smile on your gown or something. We've talked about, whether or not they should decorate their face shields, but I think since that's got to be disinfected in between each patient, it probably would just wash right off. So,
Right.
But that being said, yes, how do we put that in? So this is not a time for silly jokes or different kinds of humor. Someone has an offbeat sense of humor that might not be appreciated now when it's coming through a mask. I know for me, I never realized how much you look at somebody's face and almost read lips without thinking about it. And so now that my mouth is covered and their mouth is covered, I can't hear them either. So that's a challenge of how to communicate more effectively. And I think if we can just, add some little space back into it, you could still do some of the drawings, maybe, or fun events that you've had on Facebook, and just kind of bring people back. And I've seen a lot of teams post their pictures on Facebook and they're in their full PPE and they're all, thumbs up and smiling. So it's kind of breaking the ice and drawing their patients back in. But communication. Yeah.
Over the last decade, we have gone from personal communication to everything is over text and chat, and I've always felt that eventually the trend will reverse, because at the heart of what every human needs is that connection with the other human, and there's only so much you can do. With emails, I'm sick and tired. I mean, if you look at my email stuff, I have 159,000 emails unread over the last 10 years. And I am sick and tired of receiving notifications via text and email and over social media. So I think what you say resonates with me a lot, because we talk about this at Patient Prism, the importance of building that bond when you talk to somebody. It goes such a long way. Then, here's your appointment reminder. Here's all the checklists. At the end of the day, people are going to get tired of it. And as much as we think we don't need to talk to each other as people and just chat with everybody, I think we're going to see that trend reverse over a period of time. Not because of COVID, but I think it just to a point where we don't want to miss that connection with the human, and it can only come with the voice.
Yeah. And if you can wrap that in, even a voice text message or something, I'm sure the systems will allow that. They're very proactive, and just anything along those lines. We're looking forward to seeing you, and customize with your name. I received a marketing email the other day that was really quite interesting. This person works on memberships, and not only, you expect the introduction to say, "Hi, Linda," we have your name, but the sign that he was holding up also had my name on it. So in the pictures, this is way cool. It's beyond my technical understanding, but that was way cool. That drew me in because it was more personalized, and because I know him and I kind of watched the structure of what he does, that hit me at another level. But just reading it as a member of the group, I'm like, this is great, So that personal connection. So there'd be ways.
I think one of the things that I'm seeing happen during this crisis is a lot of our dental practices and DSOs are really refining their business models with respect to everything that they do. Whether it's communication, obviously has to be refined at every level. The phone, the in-office communication, the handoff between hygiene to doctor, the compliance related to all this stuff. I think everybody's putting their business models together. I in my view, dentistry is going to come out of this a lot more stronger and more calibrated with respect to everything that they need to do to improve the patient experience and make them feel safe at the same time. But what's a good way? There's a lot of information. Every time I talk to you, I have more questions than answers, and it's a good thing because there is so much. I think dental offices. You're absolutely right. At the beginning of the call, you said, the more questions today are about what do we do in crisis management situations? Patients get sick, team members get sick. What are the protocols? And we want to make sure we follow them, because the last thing an office wants is getting in trouble with the laws, which are not that easy to decipher. between the CDC and the dental boards, and we talked about that last time.
Mhm.
So what's a good way to contact you? We're going to list this information on the top of the screen so that people are able to email you and contact you.
Fabulous. Thank you. Our email is riskteam@lindaharvey.net. And our phone number is 904-573-2232. 904-573-2232.
Perfect. And they can always go to lindaharvey.net, right?
Exactly.
And contact you directly from the website. Because I think this is important right now to really get prepared. We don't know what if a first wave or the second wave, whatever they may call it, is going to come back. And let's be proactive and prepared for this, than wait until something wrong happens and then you're trying to fix that.
So along those lines, as we get ready to wrap up, I would like to say that I think we need to look at it like a marathon and not try to rush back. And so when you think of the practice in South Carolina, what they did was so normal. The team members were like family, like many teams are. They wanted to go to the beach together. They rode in the same car together, had lunch, whatever they did. And we're all wanting to have those experiences, as you mentioned, because we want the human touch, just to see our friends and talk and pretend even that things are normal again. But they're really not. So for our health, we just have to remember that we're in the long haul. So I would recommend that all of your doctors and listeners to this program to stay in touch with keeping the PPE, the strategies that you're doing in the practice. And while we really can't social distance walking up and down a hall in a dental practice, you can still do some other things in the practice to help maintain everybody's enough distance so that if one person gets sick in the practice, you may have an opportunity of not infecting everybody else.
And these are the things that need to happen. If you haven't already done so, talk to Linda and put these protocols in place, because we already have enough challenges in our practice. The last thing we want is another challenge arising from poor compliance.
This is what affects your reputation too. So, yeah.
Absolutely. Linda, it's always a pleasure talking to you about
you.
matters. And I think this is probably the most timely webinar we're doing on end of June. And I think a lot of people are going to get a lot of comfort from listening to you. And I definitely encourage everybody to contact you if they have questions. They need to put systems in place. Thank you again so much.
We'll get through this, yes.
Thank you. We'll chat soon. Hopefully next month when more protocols come out in place and there's more things, we'll get you back on. Thank you so much.
I appreciate it. Have a good day.